Good day and welcome, everyone. It's great to have you all here, and it's a pleasure to welcome Bilal Naved, who is Chief Product Officer at ClearStep. Welcome, Bilal.
Thank you, Mark. Pleasure to be here. And thanks so much to Healthcare Innovation for hosting us.
Absolutely. Great to have you. We're going to talk about the digital front door. And I have to say, when I talk to 10 different people about what a digital front door is, I get 20 different answers. This is a fascinating area to talk about. So let's dig in. Indeed, there are a lot of perspectives on what a digital front door is. Bilal, what do you think the critical ingredients or elements of a digital front door and front door strategy are?
It's a great question. And when I try to envision what the ideal digital front door would be, I like to think from the perspective of the typical patient consumer's journey in trying to access care. And ideally, the digital front door would help guide that individual through each question that pops up in our minds when navigating care. Often, the journey will begin with some question related to a symptom or an existing condition or a service-related need, with the consumer, the patient asking, should I go in to seek care for this? If so, what type of care? And when should I go? Is it conveniently available or in my network? And so for those first set of questions around whether care is needed or not, and what is the right type of care, there should be some component of intelligent navigation, clinically intelligent navigation, that the patient consumer can interact with and understand what is the right care at the right place at the right time. But once that individual is led to the right place for fulfillment of their care, there should be some way to filter through the various criteria of insurance, location, other preferences that the patient consumer may have, authorizations that may be needed, and even availability on the provider side to actually facilitate more intelligent matching to the exact provider and facility that could fulfill the need of that patient consumer. And once those steps have been completed, there needs to be some sort of robust online scheduling capabilities to allow that patient consumer to actually fulfill the booking or the service of interest.
That's such an important point, and I appreciate it. One of the things that's interesting is that you and your colleagues have published data that has found that only 14% of health systems said that they had robust online scheduling. That's a very low percentage. To what do you attribute that survey result?
Yeah, well, when you think about what it takes to really match people to the right provider at the right time, we have to also contemplate specialists and how to most appropriately triage and match individuals there. And typically, it is much more complicated to accurately and appropriately match people and allow them to schedule into specialists. And there's a number of reasons here. One reason has to do with provider pushback. However, the pushback is not around trying to avoid convenient ways for patients to book. Rather, providers are concerned that people are going to book the wrong slots where, for example, a new patient might be using an existing patient slot, or a slot will be taken up that needs to be kept for considerations related to somebody maybe going into the operating room soon, or that patients won't know which exact subspecialist to go to. If you need an eye appointment, do you go to a cornea specialist or a retina specialist? And the average person may not have any way to know whether or not their symptoms are suggestive of a cornea problem or a retina problem. And so that's part of the reason why online scheduling hasn't reached its current potential, because there is really not a good way, or it's difficult to provide a way to mitigate all of those concerns without talking to the front desk, because often the front desks have all the details and the clinical intelligence to help schedule and match people to the exact right booking type. So without some sort of comprehensive, clinically intelligent triage system, it is difficult for online scheduling to really be robustly implemented. And symptomatic triage is just one component or one example of a whole host of other considerations that can vary by system, including authorizations, insurance eligibility, tests, labs, imaging needed prior to visiting, being referred to that type of specialist, the exact visit type or length of the visit, as well as provider preferences, subspecializations, patient profiles, and demographics. So all of these components need intelligent, automated ways of filtering and triaging individuals to the exact booking or slot that is most appropriate for them. So making sure that the right patient types are shown and the right visit types are shown is basically the key barrier to why online scheduling has not robustly been implemented more ubiquitously across the board. And to do that, without a good triage engine, most of the systems are now looking to Epic to build scheduling decision trees to make sure that if they're asking right preliminary questions up front of people, that they're being matched to the right appointment slots. However, the solutions that are being used are often incomplete and typically for just existing patients. So it's not quite the one-stop shop we need to make robust online scheduling more ubiquitously adopted.
Yeah, exactly. And so please tell us how ClearStep is empowering health systems, provider groups, population health companies to upgrade their digital front door capabilities for patients/consumers.
Yeah, so when we go back to the patient consumer journey that I articulated, like I said, it's all about meeting the consumers at their expectations as they go through this journey and navigate the various questions that come into their mind. So if the first set of questions when somebody has a symptom are, should I go in to seek care? And if so, what type of care? We at ClearStep think of, have the capability for patient consumers to type in their concern in free text into our search bar and have our natural language processors identify what they're looking for. Are they looking for symptom related navigation? Are they looking for just administrative service related needs? Are they looking to help navigate a journey related to a pre-existing condition? And with our natural language processors, we will then identify the exact set of algorithms that that person should be led through to help identify what is the right care at the right place at the right time for them. And so these types of engines benefit systems with or without online scheduling, because at their core, it's all about decision support and providing patient consumers the information they need in their terms at their level of health literacy to help them understand what is the right place for the right care at the right time. With that all being said, however, there has been a huge focus on online self-scheduling across the industry. But as I mentioned, online scheduling alone is not enough. In fact, in today's ecosystem of understaffing, online scheduling alone can lead to bottlenecks and inefficiencies with patients self-scheduling to the wrong places and to places without sufficient capacity. So while individuals are going through our triage engines and answering questions similar to what a provider would ask them to help identify the exact best next step for them, the clinically best next step for them, we are also on the back end calculating what are the types of resources they might need, continuing to ask them questions that help us filter down to specific criteria that can take a average patient consumer and their needs and match them to the right facility and provider visit type, appointment type that's needed. And so symptomatic triage is just one component of our solution, but we are able to fulfill the entire host of other considerations that can vary by system, like the authorizations, like the insurance verification, any diagnostics, tests and labs that might be needed in advance, et cetera. And so once the patient goes through those steps of typing in their symptoms in free text, interacting with our artificially intelligent systems of questions, questionnaires, and then getting routed to a results page that is tailored to them, we then filter through provider directories and incorporate the varying logic that can vary at a system level to match that individual to the exact right place for them, that in a way that matches up to the system's needs and preferences for visit types and appointment types for that patient. And so in this way, we're providing that one component that really can turn kind of more general self-scheduling into very intelligent self-scheduling that does in fact match patient consumers to the exact right type of booking for them. And that way allowing truly robust online scheduling for and digital front door capabilities for health systems.
That sounds like a major difference between you and other solutions providers in that space.
Yes, most definitely. In addition to our ability to do that down to the exact kind of appointment type or visit type, other differentiators of ours include our clinical accuracy. We are partnered up with Dr. Barton Schmidt, who is one of the co-authors of the telephone triage protocols used in 95% of the call centers in the country. And we're the only provider of that content in a digital self-triage sort of way. And so this content has been is derived off of a content base that has been validated in over 200 to 300 million nurse line encounters. And so we're the only ones providing the same content that's already being trusted by health systems in their nurse call centers. Moreover, we have built a system and a solution that provides this highly accurate clinical content in the least number of questions, allowing for the fastest experience while not sacrificing on the quality. And kind of two other differentiators of ours include our natural language processing capabilities. We don't force our patient consumers to select from a dropdown or a keyword match. In fact, we take in their searches exactly the way that they would describe them so that we're not missing opportunities to continue building capabilities that meet them for what they're looking for. So that leads to a whole trove of data that we provide back to our partners on the types of things that their patient consumers are looking and searching for so that they can better understand the exact booking behaviors, which we can even segment down to specific patient portfolios and how certain individuals may be navigating care in one way, but others might be doing so in a different way. And finally, after having done this for a number of years, we've accumulated a sort of brand value, and ClearStep at this point is the market leader in virtual triage systems and digital front door capabilities that come out of virtual triage systems due to the size and scale of our deployments. In addition to our clinical accuracy, we have the largest deployments in the country, including the largest retail health organization with CVS, the largest population health management company, Medecision, the largest health system, HCA, and then systems in 30 other states. So with that, we have learnings that we can apply from various systems and ecosystems to other areas, but also have sort of the trust of these large organizations and that we can impart to other implementations that we deploy.
Wonderful. Well, let me ask you one final question, Bilal. How are ClearStep's customer organizations realizing the value and the ROI of leveraging your products?
Yeah, what's beautiful about our virtual triage systems and our digital front door capabilities that come out of them are that it benefits both sides of the healthcare ecosystem, whether it's the fee-for-service world or the value-based risk-bearing entities. For many of the health systems that are fee-for-service, we have conducted case studies that show 10x ROI in new patient revenue from net new patients using the experience and booking care, converting more people from the home pages of the websites of health systems, which often will have very high bounce rates, and then in lifetime patient volume. So in addition to those 10x ROI figures, we, on the other side, for systems that are more value-based or risk-bearing, or the payers, for example, or even systems that are just overloaded in today's context of staff shortages, drive efficiencies and deflection of unnecessary utilization of care, because now people who may just have a common cold are able to triage their symptoms online and understand that what may be best for them is to stay at home or to see a provider during office hours, and that they don't need to go to an urgent care or an ED, etc. And so by really helping to make clear to patient consumers what the right care is at the right place at the right time, we find that we are in fact modulating patient behaviors and helping to up triage individuals that need more care and down triage those individuals that do not need as much care fairly successfully. Moreover, as we've gained expertise in this space of virtual triage, we have come up with a variety of different solutions. For example, for Baycare, 15 hospital system in Florida, we have gone so far as deploying virtual triage systems for any number of hundreds of chief complaints, helping with COVID triage and navigation to reduce call center volume and help really make sure that healthcare resources are being utilized appropriately. We've released remote monitoring solutions with them to monitor over 7,000 patients simultaneously that once they receive their COVID positive diagnosis, and to identify those patients that need emergent outreach and to be brought back into the system, saving lives along the way. We've also released employee health screeners for employees of systems and other companies to use on a daily basis and understand whether or not they should go into work. And finally, vaccine eligibility verification systems and checking for those individuals that are unsure if they're eligible for a vaccine and not sure how to book. They can use our intuitive chat-based systems to just answer a few questions and go ahead and verify eligibility for a vaccine and book. And we're now at a point where we can so quickly deploy new solutions that we are able to, for example, monkeypox screen and logic, deploy for less than a week for any systems that may, which is now a public health emergency and highly topical in today's context. So really anything that involves helping a patient consumer navigate through symptomatic or asymptomatic healthcare related needs via intuitive chat-based systems provided by any number of digital touch points, we can provide and help systems realize the value of greater ROI and increased efficiencies, reduce call center volumes, and higher satisfaction from their patients.
That's a terrific story to be able to tell. We really appreciate it, Bilal. I know you have many very satisfied customer organizations. So thank you so much for spending time with us today. And I know there will be contact information that the audience will be able to see. So thank you and best wishes to you and your team going forward.
Thanks so much, Mark. It was a pleasure. Always love chatting with you all.
Thank you so much. This concludes this session for today, and thank you to you and our audience for joining us. Have a great day.